In this tutorial, we will enter the patient details, which are broadly divided into the contact details and the patient medical history. In the previous tutorial, we entered an appointment for a new patient, and we noted that the new patient is entered automatically in the patient database. As a revision, we will make an appointment for a new patient called Tim Flagg at 4 p.m. We enter the last name, space, first name, and we enter a contact telephone number. Press enter, answer yes, yes. In the work done, we will select checkup, and we won't enter a note, although we will mention that the plus sign indicates that this is a new patient. Patient Tim Flagg arrives promptly at 4 p.m. To record the arrival, we click on the smiley icon. The next step is to obtain the patient contact details and the patient medical history. To enter the patient contact details, click on button Patient Details, and we fill in the relevant data. The city, Palo Alto. There's a yellow border here, and we can double click and enter any city we want. Email, date of birth, double click, on the bottom left we enter the name of a guardian for the specific patient, if a guardian exists. The guardian will assume all expenses incurred by the patient. Usually children have guardians. On the top right, we can enter information relating to patient recalls and whether the patient has elected to receive text messages. On the bottom right, we can enter information of interest, including information relating to the medical history of the patient. The medical history part is best filled in after the user records the medical history of the patient, since some of this information is automatically recorded. To enter the medical history, we click on button Detailed Medical History. If no questions appear here, then just click on Copy Questions. This will load a predefined medical history, which the user may change to his liking, as we will see in later tutorials. We note that we have a column with the title Medical History, which has a yellow border, which means that the user can predefine keywords. In filling in the medical history, we simply answer the questions. Are you pregnant? No. Receiving treatment from a doctor? Yes. Taking any prescribed medicines? Yes. We can put here maybe the drug. Here in the receiving treatment, we might, if it's kidney related, we may enter a keyword kidney here, and we have already predefined it. Just enter kidney. Once we entered this word here, this is automatically placed in the medical history, so we don't need to redefine it and re-enter it. So we fill in the medical history, and then we simply print it. The patient will sign here, and it's very important to note here that we have entered a caution saying I will notify immediately my treating dentist of any changes to my medical history.